Good morning, everyone. I'm Lucy Yang with Channel 7 Eyewitness News, and I'm so humbled and honored to be your moderator today. We're so glad you could join us for this very important but not last discussion on the toll of hate crimes, really on all of us. You don't have to be the direct victim to feel the pain, to know the horror, to be hit by fear. I want to thank New York City Health and Hospitals, Elmhurst, Queens, for this wonderful opportunity. Not only is Elmhurst the second oldest hospital in the city, it remains one of the most compassionate. Not only do they care about their patient population, this virtual event we're gathered for right now shows they care about their staff as well. I should point out half the healthcare workers here at Elmhurst identify as Asian American Pacific Islanders. You are givers, you are healers, you are the salt of the earth. This month is to honor you and all you do. This specific talk is to give you a voice and some expert advice on this terrible scourge hitting our population. We have 4 distinguished guests with us today. Each will speak for a few minutes on the issue of violence targeting Asian Americans, and then we want to make sure we have time for questions at the end, and we hope you feel safe enough to share your concerns, your fears, and how this is impacting you and your family as you try to live your lives as Asian American Pacific Islanders and as New Yorkers. Just yesterday, an Asian American man was pushed onto the subway tracks. I know that hits home for all of us because we all ride the subways, or at least we want to feel safe enough to do so. Filipino nurses have been attacked on subways. A Filipino woman was savagely beaten while trying to walk to church in broad daylight. It could have been any of us. Our first speaker is Councilman Peter Koo. He represents District 20 in Queens, an immigrant and successful businessman. They like to call him the mayor of Flushing. So, Councilman, let's cut to the chase. What are you and your colleagues in City Hall doing to safeguard AAPI New Yorkers?
Thank you, Lucy. Yeah. So I'm City Council Member Peter Koo. I want to thank Elmhurst Hospital, and also thank you to all the other panelists, especially our Lucy Yang and Lillian Devino, Dr. Maria St. Gabriel, Dr. Gaska. Mental health is an issue of concern in any community, but is especially a stigma in Asian communities. This has been the case for far too long. The increase of Asian anti-hate crime has made our mental health even worse. When COVID-19 hit America, we were already the victims of racism and discrimination. Our businesses saw less customers, and anyone who looked Asian was scapegoated. Even our own former president blamed the China virus and Kung Fu. The impact was devastating, and we see the results today. Our elderly are attacked, and grandparents are afraid to go outside alone, and everyone is afraid to take public transportation. The rallies in support of the Asian community have been helpful, but they are reactionary. We need comprehensive, language-based mental health services for our community. We need to erase the stigma behind mental illness. We need to make it easier to seek help, and we need to teach people that it's okay to seek help. And we need to make sure everyone understands that words matter just as much as our actions. Our country wasn't built on any one group of people, not quite a melting pot, but more like a big salad bowl for people all over the world. So thank you everyone for attending this important I don't know, this seminar or something. Yeah. I can stay on for another like 30 to 45 minutes because I have to attend another meeting. Yeah. Thank you, Lucy.
Thank you, Councilman. Our next speaker is Dr. Maria Chona Gabriel, a psychiatrist at Elmhurst. Now, doctor, you understand the mental toll these attacks are taking on patients and employees. Can you elaborate for us?
Yes, definitely. The resurgence of anti-Asian hate crimes has taken a toll in all aspects of our lives, and this has been continuously being fueled and in the end has really affected us in terms of physical and mental health. And aside from that, there's ramifications of discrimination and stigma, and this has really been affecting us in our daily lives.
Okay, and can you talk about, we'll go back to questions later, doctor. Thank you so much. Next is Lillian Devino, the Director of Programming at New York City Health and Hospitals Adolescent Health Programs. Can you elaborate? I'm sorry, Doctor, did you have more to say? I cut you off, I'm sorry.
Yes, I think I have the slides being pulled out just before that, Lucy. If I can go back to those slides, that would be great. Yes, okay. So thank you, Lucy. So now I'm here to talk about, I'll give you a very short talk on the implications of anti-Asian hate on mental health of AAPI adults. And first of all, I'm very happy to be part of this forum. Next slide, please. And as a note, I have nothing to disclose. All right, next slide. So let me take you back to the history of anti-Asian sentiment, which dates back into the 1900s. So first we had the Chinese Exclusion Act, which eventually evolved into the Immigration Act of 1924. And of course, during the World War II, we are all cognizant of the internment of the Japanese Americans. The label yellow peril is seen or viewed Asians as being dirty, diseased, sinister, and basically invasive, and basically foreign, And this has evolved in the 1950s as the minority model, which uniformly saw Asians as being successful, however, has very limited, minimal political activism. With the resurgence of modern-day pandemics, mainly involving the SARS 2003 and the COVID-19, this fueled the race-based stigma and discrimination. As of this year, during the first quarter, it is known that hate crimes against Asian Americans has basically doubled. Next slide, please. As a background, Asian Americans continues to grow, and by 2055, it is projected that it will be the largest immigrant group. It's composed of diverse ethnicities, culture, and religious backgrounds. However, because of stigma and discrimination, this diversity has been nullified. Next slide, please. In reference to various studies, race-based stigma and discrimination, along with microaggressions, results in uptick of mental health issues. And this is basically very robust amongst Asian Americans, as seen by the study of Wang and Goto in 2008. Next slide, please. So how does stigma affects us physically and, more importantly, mentally? According to the minority stress theory by Alan Mayer, this theory posits that the accumulation of prejudice, discrimination, and internalized stigma results to poor mental and physical health. Through physiologic pathways mediated by stress, this increases the cortisol level, the blood pressure, the heart rate of patients, and results chronically in allostatic overload, meaning there's an increase in or the worsening of the wear and tear on the body. And physical health effects includes cardiac, respiratory, and pain perception, along with metabolic diseases and cognitive decline over time. Next, last slide, please. And more importantly is the mental health effects. We've seen an increase in anxiety, depression, and stress response, which may lead to either PTSD or subclinical stress responses, including fear and worry, and of course, suicidality. Last year, Taylor et al. Modeled what we call the COVID stress syndrome and the COVID stress disorder. So the syndrome involves 5 elements: the fear of the infection, the fear of the socioeconomic impacts, the fear of foreigners thinking that they bear the illness, the pandemic-related compulsive checking and reassurance seeking, and the pandemic-related traumatic stress symptoms. If this is now involves significant distress, impairment, and functionality, then what we have is what we call the COVID stress disorder. Next slide, please. In addition to that, the implications of discrimination involves reduced access to public health. The patients or the people are discouraged to help seek behavior, mainly because of the theory of double stigma. And double stigma means being a minority and also having a public health or a mental health issue. As we all know, Asians is the lowest mental health utilizer, as per the study by Park, Simpson et al. It is very sad to know that there is dearth of data and infrastructure. There is minimal funding in terms of studying the Asian Americans and other ethnic groups. And we all know that does not only involve the Asian Americans, there's a spillover to affect other non-dominant groups as well. Next slide. And lastly, to know is that after having known all of this, we remain optimistic. Why? It's because of the continued efforts of the community in various sectors of our community, the development of specific interventions by the clinicians and researchers, CBT, family level supports. There's an increase in civic engagement, increase in mobilization, the motivation to tackle stigma. And of course, there's this uproar on social media advocacy, the Watch the Hate and Stop AAPI Hate platform. And very importantly, just recently, basically last Thursday, there is the signing of that Hate Crime Act into a law, which eventually gives us some positivism and optimism regarding this problem. Thank you, Lucy.
Thank you so much. I'm so sorry to interrupt you earlier. That was wonderful. So much information there. Thank you. Next is Lillian Devino, the Director of Programming at New York City Health and Hospitals Adolescent Health Programs. Can you elaborate on the short and the long-term impact this is taking on our young? Are they growing up fearing that their ethnicity puts a bullseye on their back? We're hearing so much about the mental strain from a year of learning remotely this past year, but for the AAPI young population, now another fear, violence against them. Lots to unpack here, Lillian.
Yes, thanks, Lucy. It's an honor to be here with everybody and also alongside these amazing panelists. If we got the slides up, we should actually answer your question, Lucy. Next slide, please. So I'm going to focus on API youth and how it impacts them, how anti-Asian hate impacts them. So first, just understanding what IPR youth are you experiencing. This is actually from the Stop AAPI Hate report. We see that 13% of the victims were API youth. And most of these incidents included verbal harassment, shunning, and physical assaults. Furthermore, 48% involved multiple perpetrators, 41% were youth on youth bullying, 60% involved bullying from an adult. And this is on youth. And then 40% of the adults where adults witnessed the bullying, only 10% intervened. Next slide, please. So the dramatic rise in bullying in 2020 among Asian American youth. This is from the Asian American Bullying Survey. What they found is that 80% have experienced bullying and 70% reported an increase specifically in experiencing or witnessing cyberbullying as a result of COVID. Asian American youth are significantly less likely to report bullying to an adult. We saw that only 38% of the youth told an adult compared to 63% of their non-Asian peers. And they have limited access to resources or ways to get help. Only 50% of adults took action after learning someone was bullied. And in the survey, we see parents, caregivers, and educators of Asian American youth reported not having necessary knowledge or tools to address bullying. And some of this could be explained to the cultural barriers and lack of trust, which Dr. Gabriel actually had referenced earlier. Next slide. So what I also want to make sure before we go further, I want people to know bullying and hate crimes are types of trauma. By definition, trauma is experiencing or witnessing a serious injury, the threat of death, or a violation of personal integrity. Anti-Asian bullying and hate crimes stem from historical trauma, which is the cumulative, multi-generational, collective experience of emotional and psychological injury in communities and in their descendants. We've seen this in the US with Native Americans, with slavery, the Japanese internment, refugees from Vietnam and Cambodia, and also September 11th. What we're witnessing now is historical trauma exacerbated by COVID-19, particularly in communities of colors. such as the events surrounding and following the George Floyd murder for the Black community and the rise of anti-Asian hate associated with COVID-19 disease since early 2020 for the AAPI community. Next slide, please. So what I wanted to also focus on is the adult piece, if you notice the data. So how can we help youth feel safer? And adults really play a clear role in helping youth understand and establishing a sense of safety when violence occurs like hate crimes. So what we want to first do is reaffirm safety. You've got to make time to talk about what the youth are experiencing and ways that are age appropriate, language that they use that's also developmentally appropriate. Sit down with them to review safety procedures and come up with a plan. Check in with them to monitor their emotional responses. And as best as possible, try to maintain a routine that provides structure and some kind of consistency. Lastly, if you notice the youth continues to have difficulty for more than 2 weeks, that's actually when you should think about seeking additional support. Next slide. And when we talk about youth, these are different approaches depending on their developmental stage. So for young children, you want to be honest, using simple, balanced information that makes them feel safe. Maybe think about ways to identify trusted and safe adults they can turn to. School-age children, if they have questions, answer them to help them separate reality from fantasy. Talk to them about efforts in schools, the MTA, and the community that are existing that make it safer for APIs. Also make sure you ask where they're getting their information so you can actually sort through it. You want to make sure and help them understand what they see and hear and that the information is age appropriate. For tweens and teens, they're trying to grow up and have more autonomy, so they may start to have actually strong and varied opinions about violence. So have them actually take an active role and you guys co-plan in their safety planning and to ways to seek help. Keep the conversations open. Also, if you notice that they have biased thinking or use hate speech, and call attention to it and have conversations around that. And for youth who want to take action, support them to find positive ways to make a change, to channel that energy. And this could also help them regain a sense of control when they're feeling a loss of it. Next slide. For parents and guardians, in general, talking about race and hate is difficult, but it's so necessary. First and foremost, listen and validate your child's feelings without judgment. Don't avoid talking about race and hate, especially if it's in their face. Silence will not address the problem nor put youth actually at ease. Be clear, direct, and factual, and encourage questions. And it's okay if you don't know the answer or you can't answer them. That's actually good modeling to show that adults don't always have the answers. And you can also model curiosity by then learning with them. Okay, let's find out together. And then be real, but also show your emotions in a way that's grounded, but let them know like you actually you're going through something as well, that this affects you. And it's the reality is everyone has biases, is what we do with them that could be helpful or hurtful, and that's the conversations to have. And you want to keep that open so they continue to come to talk to you when they have questions or new things come up. For yourself, rely on your support system for advice and to process your own feelings around race and hate. And then also there are other outside supports or resources, particularly right now for anti-Asian hate efforts, so that can help you how to talk to youth around these sensitive topics. Next slide. And I really want to, since we are here at Elmhurst, I did also want to just emphasize what healthcare adults can do. First, they can play a role by just asking about violence. It lets youth know that they are not alone. You're a safe person to talk to. And you want to ask every youth. I think with the mild minority, sometimes we forget to ask certain groups, if they're having a bad day. So this normalizes also as a part of standard care. Assure safety if violence is disclosed. Make sure you have the referral personnel or resources that you can share with them. And it's not too late. You can act now to make your office or agency a safe place for youth to talk about violence. This includes trainings, collaborations needed for referrals, and educational materials with resources. Next slide. Any adult can do this. Ask Asian Pacific Islander youth, how are they dealing first with COVID? And this comes actually from our Youth Leadership Council. Just ask them how they're doing. I think that's for any youth. And then particularly since we know what's going on, have they experienced any discrimination and harassment recently? And how are they keeping safe? Next slide. So what I put together, and hopefully we'll be sharing these slides with you, I did put a list of resources together. Some of this is based on the information I've shared with you. There are also resources for allies who want to challenge anti-Asian bias. And I also have resource for health professionals on how to combat racism and reduce health disparities, which really is to advance health equity for youth. And the last piece on here on this list is Mindful of Race, which is a book by Ruth King. It's for individuals who work, who work with communities of color to help understand how we can be conditioned to think and react and how that actually impacts our own racial distress and healing. Next slide. Another just a resource, and you can actually contact them. You can download their website, is Strategies for Staying Safe from the Asian American Federation. They have tips for verbal escalation, nonviolent communication, and the 5 Ds of being an upstander for bystanders, which is direct, delegate, distract, delay, and document. And you can also ask them if you want to get these booklets as hard copies to share with your places of work or people in your community. And the last slide, please. And then I leave you with these photos taken by 2 of our Youth Leadership Council members. These photos were taken for a project where they were asked to document their daily experiences during COVID. The photo on the left was taken by age 18 at Lincoln Terrace Park in Brooklyn. She's a runner. She took the photo in honor of Ahmaud Arbery, age 25, an athlete who was shot while jogging on February 23rd just this year by a white supremacist. The photo on the right was taken by Antonella Filippo, at a Stop Asian Hate peaceful protest in Flushing, Queens. She attended the protest to support her best friend who is Asian American. So the YLC is a diverse group of youth, Black, Latino, Asian, South Asian, and white. Race and racism comes up often in our meetings. We've made an effort to create an open and safer space for these discussions to happen and so that they can support each other, which I hope is reflected in these photos. And lastly, I share this with you because these are my kids who will give me hope and remind me why I continue to fight for racial injustice, for APIs, and for all communities of color. Thank you.
Lily, that was wonderful. Thank you. So much information to digest and great resources. We appreciate that. And our final distinguished speaker is Dr. Vladimir Gaska, a psychiatrist and the Director of Behavioral Health and CEO of Elmhurst Hospital. Sir, if you will address the importance of mental health on your staff, how they must care for themselves as well as their patients, and I believe you have some important resources to share with all of us.
Thank you so much, Lucy. Just a correction, I'm not the CEO of the hospital. Ms. Arteaga has been with us for the last 3.5 months, and we're very happy to have her because she is an advocate for the community. She is with us in fighting discrimination and stigma. And I think she was scheduled to be with us, but she couldn't make it. So I think there was an issue with the titles, but I am the Director of Behavioral Health Services. And thank you to Lucy for bringing us together and for bringing the voice of the Asian American Pacific Islander community out there. I was taking some notes, and I would like to first of all thank Peter. I just imagine how relevant is this issue in Flushing. As Lucy says, I think they call you the mayor of Flushing, and how much you have accomplished and a lot of the work that you have done for the community. And I thank you for your participation. Dr. San Gabriel gave us some very important historical context for the discussion today and the clinical implications of hate. And I love the optimism slide at the end because he's really calling for more media advocacy. And I think this panel is proof of that. Cross-racial and political and civil engagement and the need for more research. I was actually quite surprised that you found out that we need to do a lot more research and provide more culturally sensitive services for the AAPI community. Ms. Devino, your data and your insights on bullying, very shocking to see how much has that grown, but that there are resources, and your guidance for parents and the resources that you provided to us are very, very crucial. Thank you so much for that. So I like to say a few words, and I have a few slides also. I heard someone said, Asian is not a virus, but
can I talk to you later? I'm in conference.
But racism is.
Thank you.
So the repulsive comments heard from the top of the previous administration just made things worse. They fuel the already fragile dynamics of racial disparities in our community. We cannot be silent. We have to raise our voice against bigotry and racial injustice. We must believe that change is attainable, and we are working and will continue working together in eradicating this real illness. Next, please. And next one again, please. As clearly stated by all of the panelists and by Lucy today, discrimination and violence against minorities affects the overall community's mental health. Elmhurst Hospital serves the most diverse population in the entire planet. Our staff is also extremely diverse. So we are very familiar with minorities suffering from discrimination and experiencing mental health issues. When we belong to a minority, when we are people of color, or we look different from the majority, we can be subjected to discrimination and racial attacks. Subtle but painful microaggressions can be frequent. And recently, serious incidents have become more common, and the consequences have proven to be at times catastrophic. If you or your loved ones have experienced discrimination or have been the victims of hate, or if you already know that you are suffering from stress or anxiety or depression, the way that Ms. Devino and Dr. San Gabriel described, please know that there is help available. Let's continue to fight stigma together. Let's continue to educate our children and to educate them about emotional pain. In many of our cultures or minority cultures, we sort of have this wrong sense of stoicism, and we suffer in silence. That has to be changed. We need to make sure that the new generations understand, and that we now understand, that it is okay to be sad, it is okay to be nervous, and it is okay to seek mental health, professional help. Next, please. So the next few slides are just going to show you several resources available. Some of them are very similar to what Ms. Devino and Dr. San Gabriel show. Just for you to know, there are anti-hate resources. There are resources for help you how to actually fight back if you are the target of violence, hate discrimination on the streets. Of course, there are health and mental health services available. Next, please. And Health and Hospital has, 11 big facilities and 70 community clinics. And just to mention a few, Governor, Bellevue, and Elmhurst do have Asian American culturally competent services with not only, as you should probably know, that we have interpretation services for any language, that you can imagine, but also in-person services are available at these 3 hospitals and many others, but just mentioning these three hospitals. Elmhurst Hospital, that number right there, I bolded it and I wanted you to write it down. 718-334-3902 is the number of our Asian clinic. We have in-person services in Korean, Cantonese, Mandarin, and many of the other Southeast Asian languages as well. Next, please. Just to mention a few more, here there are several listed. The Charles B. Wang Community Health Center is a big organization that we actually have some collaboration on an ongoing basis. The Child Center of New York is also available for any AAPI community members. Next, please. Some of the hospitals like Jamaica Hospital, Flushing Hospital, Gracie Square, the Hamilton Madison House is a very popular organization that serves Japanese, Korean, and Vietnamese and Cambodian population. Next, please. some other institutions. I'm sure that these slides are going to be shared with the community, and we'll make sure that you have them, but many of these resources are available also online for you to search. I'd like to mention the last one that is available for all languages, and since suicide is also a feature of people's under stress and suffering from psychological distress due to hate, National Suicide Prevention Lifeline is available for everybody. Next, please. So I'd like to remind everyone that in addition to the resources available from hospitals and from mental health organizations, the city has internet-based platforms such as New York City Well and New York City Health. Also, you can reach out to 311 if you want information on the phone. If you are employed, many of you on the forum today may be employed. Remember that your organization, your company, your institution, if you work for a hospital or for H&H, your HR office, the employee assistance program, your insurance, your PCP, your union can be a source for you to find help. If you are working in health and hospitals, one of the ways for you to seek psychological help is through the Helping Healers Heal program. Next, please. And I'm just going to tell you briefly about this. This is a program that Dr. Katz, the president of the corporation, and Dr. Wei, the vice president of the health system, they both brought this from California, from the experience there. And it was intended and is still a second victimization program. But because of COVID last year and because of the need of the staff, it became the preferred way to provide psychological support to our staff for any type of situations. The program has 3 tiers of support. There are facilitators in all services at all times. Referrals can be made by phone, text, email, or directly by in person. Next, please. So just to conclude, you know, we each of us, we need to do our own part. We need to help each other in accepting our differences and celebrating all people alike. We need to embrace each other. We do have the healing power. You know, this community, each of us in our disciplines, working together can attain the same goal that we all trying to achieve. Let's support each other. Together we can. Next, please. Just leave you with a thank you from last year in front of our hospital from one of our artists in the community. Thank you so much for all of your attention, and thank you for having us. Back to you, Lucy.
Thank you, Dr. Gasca. And anytime you need me to just promote you on the spot, I'll be happy to do that. Thank you. That was fabulous. That was really great. I know Councilman Koo has a tighter deadline, so I will start the follow-up questions with the councilman. And also, I want to encourage those who are tuning into this to please text in your questions. We would love to address them for you while we have this panel of experts before us. Councilman Koo, I was hoping you could talk about the Asian Hate Crimes Task Force. And I understand they're not really funded, that all the detectives have other assignments. As a councilman, what can you say about this particular task force, how to beef it up and make it really effective for the community?
Well, the Asian Anti-Crime Task Force it was set up voluntarily in the NYPD. And so I have asked city to give permanent funding for this particular unit and make it permanent. And in the beginning, I asked them for like $5 million, you know, to start off the program. But I haven't heard from them yet. You know, we are in the budget negotiation process right now. So in the next couple of weeks, we will know more detail about this. Yeah.
Okay, thank you. We definitely have to fund a very important task force out there, and they are the ones with bilingual detectives who can reach out to the community.
Yeah. Mm-hmm.
Thank you, Councilman Koo. Thank you for joining
Lucy.
us.
Thank you.
We appreciate that. Lily, the young have always been described as invincible and, you know, ready to go climb mountains and move mountains when they're ready to strike out on their own. Do these crimes take away their courage? Can you talk about maybe long-term impacts? Will they feel crippled by these attacks because they don't know if there's someone behind them, to the side of them, in front of them, who would tear them down?
That's a good question, Lucy. So one thing that does impact somebody's long-term, I would say long-term, but what can really play a factor is the age of when the violence occurred to the youth, you know, and the supports around them. So my background actually has been in trauma, and I deal a lot with this too, like being believed that, you know, this is a real, you know, anti-hate crime, you know. The age, again, also how we talk to a 5-year-old is going to be different than you talk to a 15-year-old about their experiences. And then also, you know, just what available supports to help them move through, you know, to regain a sense of safety, control, and that, you know, they can recover. I will say this, just to add more optimism. One reason I'm in the field of trauma, because people do get better. It's just, it will take, you know, it does take a recognition, being believed, and putting the healthy supports around a youth. That will protect anybody and start the healing process so they can move forward.
And Lily, one of your bullet points, you said 60% of the young who were bullied by adults. We tell the young to seek help from adults.
I know, right?
There's a little, yeah, talk about that a little bit more.
Yeah, and thanks for calling that out. And actually, that's actually why I shifted my talk to focus a little bit more about, you know, there's only so much also youth can do, right? They don't have literally concrete resources. And I think especially with younger kids, they don't have the voice. And then I think there's still stigmas just in general with adolescents where, oh, they're just going through something, or, you know, this is just them acting out, right? But the adults who also, no matter what age, whether from 0 to 18, even, you know, past 18, and this is the work that we do at the Allison Health program, is they still need guidance. They still need to know, they need to learn accountability, but they also need to know they can do things. You know, and I think many different groups are told what their group can do and cannot do, and the same thing applies with Asian Americans. And going back to what Dr. Gabriel mentioned, I think how the model in Nori has hurt the Asian Pacific Island community, including youth, is holding on unrealistic expectations on Asian Pacific Islander youth who actually aren't doing well in school, you know, who are actually depressed. And no one's asking them, how are you feeling? You know, we do all these PHQ-9 screenings. Are we asking, that's why I say, are we asking everybody the same screening tools? I think the lens we have sometimes on groups can also hurt us. And there are Asian Pacific Islanders, typically we know that aren't doing well, like subgroups. So I think that answers your question, where it's about supports. It's about also, you know, making sure we don't pigeonhole. I mean, any group, but definitely there's a specific pigeonhole for API youth.
Thank you, Lily. Dr. San Gabriel, you mentioned Asians have the lowest mental health, are the lowest mental health utilizers. Is that an ethnic thing? Is that taught? Don't talk about this. Everything's fine. You know, just keep working, and don't make waves. Is that part of that, or can you elaborate a little bit more on why that is?
Well, Lucy, it may be part of that. Yeah, true. What you're saying is that it might be part of the culture. It might be part of just us being what they call Asians, right? But a very important part of that is that what they call the double stigma theory, which I've mentioned is that, you know, we normally, well, number one is we are part of a minority. That's one of the facet of this theory. And the other facet is that we are basically not ready to seek mental health. We are not there. And that part is pretty much part of the stigma of mental health as part of our culture. So combined with being a minority and being this, having a mental health problem, that therefore contributes to this decrease in the need and the decrease in the want to seek help. And basically that in the study that was mentioned by Park et al. Shows us that Asians are basically the lowest mental health utilizers in the country, which overall is pretty much very sad, because right now we are facing this stigma, we are facing the discrimination. And as a human being, we all need help, and we need help at the moment. Basically, we need to prioritize this.
Yes, thank you. Thank you for underscoring that. And when we hear of all these crimes in the news, and I can tell you, we don't even cover all the crimes in the news. We just cover the worst ones, the headline makers. Can you talk to us about internalizing when we see these attacks on innocent people just walking down the street or living their lives? Should you not internalize that? Should you internalize that? And I have to confess, I walk all over the city. I cover the city. I talk to strangers, but I have felt hesitant to not walk in the park recently. And is that unhealthy?
It's very hard to say it is healthy or unhealthy. I would say it is going to be a case-to-case basis. You know, it's how an individual adapts to this, what's happening around us. And I believe that each person adapts and arrives at a solution with what is happening right now. So it's just very difficult to say to internalize or not to internalize. At the end of the day, as long as we find it healthy and helpful for us to be able to adapt of what's going on, then that's going to be the healthy one, the healthy decision for us.
Okay.
Lisa,
Thank you.
may I add to that too?
Please do.
Yeah, so, and I think because of my work with rape crisis, I think the way I've been managing what's happening is we're kind of in a crisis mode. So right now it's about stability, it's about being safe, and then thinking about how we can get back and navigate the world. And that's actually how I'd work with like people who've been traumatized. I even speak from my own experience from over the weekend. I finally got to go to a party. We're all vaccinated, but I still had that layer of watching over my shoulder. So I actually made the choice to leave early to make sure I wasn't out late. And I hate living like that, but that is the reality. I think that is very different when I walk out in the community other nights. I mean, it's that lens is there, but I have to be sure I'm safe. So once, hopefully, I hope this dies down, right? I definitely need, I'm a social person, but I also want to be around for the next day too.
I hear you. So I think we've all taken a page and it has changed our lifestyles. Right, Lillian? I want to move to a question from somebody who's watching this event. Culturally, API community doesn't talk about mental health. How do you begin to talk about mental health with our own? How do you open up that discussion at the table? That's really for anyone to tackle.
I can give a shot. So actually I have taught a course on Asian Pacific communities and mental health. And some of the things that I try to talk about is then how to redefine in whether it be language or in ways in our own cultures that we identify with that actually is positive mental health. I think my work has been around how do we translate that and how does it make it relevant to the different communities, because we're a diverse community. I think, and I can only speak what I'm working with the Filipino community, I think we have our own background of internal racism because of colonialism. So that work is going to be different, I think, for another Asia Pacific Islander community. But, we have definitely a lot of also religious ties to this martyr way of dealing with problems, and so it's still I don't have the direct answer, Lucy, but this is something that I am actually working on. How do we maybe just use different wordings, but also understanding, I think the hardest part is just seeking help and talking about it. And it doesn't always, by the way, have to be talking therapy. It's just, we need another way, a different model for API communities, just because we're so different.
Can I chime in on that, Lucy?
Please.
Yes, I think because basically right now, it is true that culturally we do not talk and we deal with this in silence, as what Dr. Gasca has just shown in his slide, right? Which is very sad. But I think with the things happening around, we're able to open our eyes that, this is beyond what we can tolerate. And now we have to start talking. And I think knowing the services that we have and having that compatibility in culture, in the language with people who might be there to be able to help us, having that kind of a connection might be able to help us or help the the community or the people talk and be able to open their problems, right? That's why it's just very sad to know that the resources out there is very limited. And it's also very sad to know that not everybody knows about that. So I think this platform is very good for everyone, especially this group of people or these minorities, that they know that we are here for them. We have resources and they can come to us and seek help. And no one is being judged here. We're here to help as clinicians. We're here to help as professionals, and we take them all seriously, and their lives are very important for us.
Thank you. I think we all need to hear that. Even healthcare workers need to hear that too. And we have an excellent question here. When an Asian victim of a hate crime asks, "Why me?" What is the supportive response to that question? Maria, you're in the hot seat, so you go.
That's a very tough question. I do not have an answer to that. Probably my first, I would say, the first thing I'll do is just be silent about it and just for us to reflect, because I don't really have any answer to that. And that's my very, very honest question. I'm hoping it's not you, but at some point, yes, it had been you. And I guess having what happened to that person, I would probably just help process that. But my short, honest answer is I do not know, and I'm sorry that happened.
So sometimes a listening ear is the answer.
Oh, definitely, definitely. And just being there to listen and knowing and you know, having that alliance, the Therapeutic Alliance, that's what we call it. And just, you know, having them understand that no one's being judged here. We're here to listen and we're here to help. And at the end of the day, we don't have all the answers. We don't. But that you're not going through this alone.
Yeah. And before
Yes,
COVID, I would have added a hug to that, but now I don't want to get yelled at for saying we should give a hug to someone who needs it. Dr. Gasca, I have a couple of questions for you. If one of the employees is troubled by these events happening and doesn't have time to process it, or doesn't want to take time from their job to deal with the toll it might be taking on them, is there anything wrong with ignoring it, pushing emotions to the bottom of the barrel? Is that unhealthy? And a sidebar to that is another question we just got from the audience. How do you refer someone to counseling without making them feel defensive or getting some pushback? How do you suggest it and open the door in a welcoming way?
Understand. So Lucy, obviously, at the hospital level, getting people to accept services is very hard. In a hospital like ours is very difficult, especially last year during COVID. We did have the Helping Healers program available for everybody. We have rooms just provided for the staff to go and talk to someone if they were under stress. Obviously, the medical needs at the moment in the community were so high that people will come to us and tell us, "Thank you so much for having all of that there, but I haven't had a minute to go to even think that I will get my help because I am helping other people to live, to survive." So it was a very tough situation. So the more we thought about how can we reach people at where they are, and that's why the programs had to be innovative, and we have to really find ways in which the person feels comfortable reaching out. When I presented the Helping Healers Heal, how can you access services? Right now with technology, we text, we don't use the phone as much, but we email. We like to have someone right there that we know is a person that is knowledgeable about psychological health and can debrief us at the moment, and we can actually ask, you know, could you please help me? The second question that you have is making somebody uncomfortable. And obviously we have so many different takes at mental health, you know, because we have such a diverse population in New York. So it is hard, you know, is this person going to be offended because I'm suggesting they should have psychological help or talk to someone? But it's like asking patients if they're suicidal. Many a times we thought, don't ask if they're suicidal because they might actually think of doing it even more. And we know that that is false. The same thing applies to you asking people to seek help. It is important that you, in an empathic manner, that you reach out to them and in a frank way, say, if you need help, I can help you to get connected, and these are the resources. In emergency situation, you had to be a little more forceful, but if it's just someone going through a bad time or being the victim of an attack that it hasn't been so serious, then it's important just to reach them at the level and to make sure that they understand that we are there to help them. And as you said, Lucy, sometimes it's just that shoulder and that comforting word that is necessary for people to open up.
And we have a follow-up question to some of the points you're making. Is it hard to get an appointment at Elmhurst Asian Clinic?
I yesterday I called the number to make sure that someone was on the other side of the line and picking up right away. And I was delighted to hear that a person of Asian culture pick up the phone and right away, so it's available and they are ready for you. If you need services, please pick up the phone and we'll make all efforts to connect you to the proper therapists, the proper services in our hospital. Sometimes, depending on the availability of mental health providers, there is a crisis of mental health providers in New York and in the States for psychiatrists and therapists, and especially finding competent staff that speaks the languages that we need sometimes is difficult. But anybody, can come and call and we will address one by one and make sure that they get the services they require.
So I feel like the staff have gone from crisis to crisis. We went from a year of saving lives to now this crisis next. And there's just no time left in the day to take care of themselves. So I just want to go back to pushing this to the bottom of the barrel for people. And should they not do that, especially your healthcare workers who deal with so much on a daily basis at the hospital and taking care of other people all the time? Should they make that window of opportunity for themselves, even if it's not a formal appointment with someone? Should they take some time for their self-care?
Yes, oh, absolutely. They should have that time to be able to seek help and connect to services. I was trying to emphasize that as an institution, we had to make the means easy and accessible and available at all times. We struggled last year, but finally we have been able to provide the services at all shift. Anybody can find someone to talk at any time. And as I said, we have rooms that are dedicated for people just to go and relax and to, have a drink, have some water, have something to relax them. There are some meditation rooms that we have in every hospital now available. So absolutely, you're just keeping, day after day suffering. And as I mentioned, so the silent pain is not good. It eventually will burst, and why not to tackle it from the beginning?
Thank you, Dr.
Lucy,
Gasca.
if I may add, yes, Lucy, if I may add, I think it's very important that to understand that as clinicians, we have various services here working together for the patients, for the better, for their treatment. As clinicians, we do have to acknowledge our own need to be able to help others. It's very imperative that that is done, because without having a good state of mental and physical health, it's very difficult to offer that service to others. So it's just very important to understand yourself as well and to do what is necessarily that needs to be done to be able to continue on helping other patients.
Last year, Lucy, we were some of the services were so tired that actually the CEO started to sort of mandate vacation. You need to go on and take some days off. You cannot be here, working this way. So we really had to take the lead on making sure that our staff was, healthy as possible.
Fantastic, thank you. And Lily, did you want to add for the young who might be listening, some words to getting help if they need it?
Yeah, actually, I think there's definitely youth oriented organizations, I definitely recommend our pediatric and adolescent primary care settings. We focus on mental health, reproductive services, as well as primary care. And these are people that I work alongside with who adolescents and young people can talk to. I also know there was a question about how do non-Asian youth support their peers, their Asian peers, and I think just learning about each other's culture is actually important. So I have discussions about my experiences with also other people of color, and we learn about each other's experiences about how and I think it makes me more understanding of where I fit in, and also they have an understanding of what my history is, or what our community's experience.
And Lily, for the young, is it okay to have anger as the response to what's happening out there, and to sit on
Yes.
anger?
Well, yeah, and I think anger is the easiest thing to tap into, so that's why I think it's a good thing. I think if you can sit down with youth and understand what are the layers of that anger coming from, because they could be angry at so many things, and I think even for me, we've been experiencing just the past year, I'm angry at so many things, so it's really helpful to sit down and piece it out. Are you angry at the world? Are you angry that you can't do anything? Are you angry at people not doing stuff? And I think it depends on the individual, but sitting down and start, what are you angry at? And then go from there. Because I think we get lumped to sad, angry, and happy, right? There's so many other emotions out there. I think what's underneath the anger is a good way to start and flesh that out.
Did the doctor, did you want to add to that as well? About the anger issue, the anger component?
Absolutely. The emotions are very diverse, and people and minorities have different ways to express, their feelings. I was always surprised and by the fact that in some languages, the word depression, for example, is not available. They don't have a way to express certain feelings the way in the Western cultures do. So it is very important for us to educate ourselves on how is this person expressing themselves, when they are feeling what we in the Western cultures describe as anxiety or as depression. What words do they use, and how are their mental health seeking behaviors? It's really important for us to know.
Thank you so much. And I'm just going to check if there's any other questions that have come in. And I hope those who are listening, even if you didn't ask a question, but you have a question, you will seek someone. And Dr. Gasco gave lots of resources out there. As to the other speakers, please utilize these available resources to you. I'd like to thank everyone who joined us virtually for this discussion. I hope you know you are not ignored. Your mental health, your physical safety, you are all important to all of us. I would like to thank the many hands who made this virtual discussion possible, especially those who worked behind the scenes to get our technical stuff together. I would like to thank our speakers today for your time, your expertise, your love, your concern. And I would like to thank New York City Health and Hospitals Elmhurst for inviting me to join you on this very important discussion. I learned a lot. I hope you did as well. So be well, be safe, and God bless. Thank you.